CA community, and good afternoon to Captain Jarret for joining us today here at the hospital so that we can provide you the latest updates related to the COVAX vaccine. For most of us, we are nearing the year mark for when the pandemic hit. We will forever be able to tell our families these stories, and for each of us, it has been a series of sacrifices and compromises to get to this point today. I'll personally never forget calling my team in on a weekend and the look on their faces when I told them we were no longer letting patients into the hospital that had colds and coughs. That seemed so unusual at the time that we would stop them at the door. And now what seems so strange is commonplace. I want to thank each of you in the community for your patience through all of the changes. I would personally like to thank my staff for their complete dedication and agility. All of us have struggled as the rules and the procedures change so quickly, it is nearly impossible to keep up. With all of that said, the great news is the Yokosuka military community has not seen a direct loss of life due to COVID. Due to the strong partnership with Captain Jarret and CFA, we have had aggressive testing, quarantine and isolation procedures with medical checks, contact tracers hunting for index cases, and administration of all the cutting-edge medical therapies in our emergency department. Our COVID inpatient ward has been activated numerous times these past 6 months, and as recently as last week. So I appreciate your patience and understanding with the visitor policy as we continue to try to limit the exposure of contagious patients to you when you are at the hospital. Starting today, we have an open virtual ICU capability with doctors and nurses from Naval Medical Center San Diego that can support and oversee care from the United States. Of course, we hope to never need these services. Since the 26th of December, we have been on the offensive with the arrival of the Moderna vaccine. As an initially designated pilot site, our focus was on the cold chain management and safe distribution of the vaccine while avoiding all waste. I am happy to tell you that over a third of the base is now vaccinated, and with that, we have seen no serious reactions, no vaccine-related hospitalizations, and less than 5 people have been seen in our emergency department with minor flu-like reactions. We have learned a lot of lessons along the way, specifically as to how to avoid wasting any vaccine. We saw in the first week that between the holiday period, unpredictable arrival dates of the vaccine, and the requirement to give the vaccine out within a day and exhaust all supplies within 72 hours, that we had some extra early shots that could have been better allocated according to the priority list. For that, I'm sorry. We learned quickly and created SOPs that created proper standby lists according to priority order and contained better contact information to execute that. We work closely with the line leadership that is on site during our ShotXs, and they approve and help activate these lists so the medical team is uninterrupted in giving out the vaccine. We have lost only 1 dose of vaccine in the tens of thousands we've given. For most of you, your biggest question is, when will I receive the vaccine and how will I know? The current status is that we are nearly complete with the vaccine of the fleet, and you will see that we are beginning to vaccinate frontline workers in shore commands over the course of this month. Lieutenant General Place, the Defense Health Agency Director, who is in charge of the vaccine administration, has stated that our goal is to vaccinate 80% of all the 9 million beneficiaries by the 4th of July. If supplies are adequate, I'd love to do that as soon as possible, but that is our target for completion. However, we did see some recent slowing of shipments due to weather in the United States and other locations that weren't a part of the original pilot, but now need to receive shipments too. This did slow down our rollout the past 3 weeks and caused delays in those that needed second shots, and we are now completing them. We do have some additional good news. We have been designated as a site to receive the newly FDA CDC approved Jansen Vaccine, also known as the Johnson & Johnson vaccine, which should make reaching this target date easier. I will share with you that we are ready today, if supplies were adequate, to vaccinate the entire base in a week. In the U.S., according to the CDC, 13% of all Americans have received the first dose, and 6% their second. Across CFA, over 33% have received their first dose, and 6% their second. I know it is frustrating. It's frustrating waiting, and I'm frustrated with you and for you. What I can and I have promised to you is that when we receive the vaccine, we will not hold on to it. We have an amazing rate of getting the vaccine into arms within 72 hours, and every time we do this, weekends and holiday weekends as well. Finally, I would like to touch base on one additional community concern, which is why is it that our sister services or other bases are further ahead than us, with families that may have already received the vaccine? The issue is that we have the largest fleet concentration in this AOR. We have over 40,000 people in our fleet, while the other services combined have under 3,000. We also have close to the highest acceptance rates across the entire Navy, some units with over 95% acceptance. The good news is that we are nearing herd community in these units, and we are on our way to establishing that for the base. I know you also have questions as to who determines the vaccine schema and the prioritization. This is a perfect segue for me to turn to Captain Jarret and ask him to speak about the distribution of vaccine at large and the DoD, CDC, HHS priority list, as well as updates on COVID outbreak across CFA.
Well, thanks a lot, Captain Rice, and thanks for inviting me here to join in this town hall this afternoon. This is a really encouraging moment for all of us, and that encouragement began, I think, the day after Christmas when we started to first see the first shipments of vaccine arrive and folks line up outside the Hawk's Nest here in Yokosuka. And we really have seen some tremendous effort on the part of the hospital, the part of the fleet that's organized a lot of these SHOTX events, and we'll soon be transitioning oversight of the SHOTX events to the installation and also with Navy Region Japan as we start to work our way into our civilian workers, our frontline workers, our family members, and the remainder of the beneficiaries. The results we've seen so far with our fleet sailors have been tremendously positive in terms of the outcomes. I mean, we have really squashed this virus in its transmission and stopped it in its tracks in some of the places where it's been easiest to transmit. We learned this a year ago, back in February, when the Diamond Princess pulled into Yokohama. We learned firsthand that ships are terrible places to have a virus like COVID-19. And to have been here as the CO of a base that has 12 ships assigned it's not been the easiest feeling to have over the past year. But we're starting to get ahead of it, and now we're starting to work our way into some of the other risk areas in the community, and those will be happening soon. And so I look forward to seeing more SHOTX events and getting people through the door as quickly as possible and as quick as the vaccine arrives. And it's a great team here. Carolyn, your team leading on the medical side, and Navy Region Japan will be leading here on the shore side, along with a lot of installation support to get people through the line, shots in arms, and hopefully soon back to normal. But I will continue to emphasize we're not done yet. And until we reach that 80% goal, no one is done until everyone is done. And so we got to continue to keep our guard up. The masks, physical distance, close contact lists, those remain incredibly important to ensure that we only have positive outcomes going forward until we can actually wave the checkered flag and call an end to our COVID-19 response. So thank you.
You're welcome. All right, so thanks to so many of you who put your questions forward in advance. We want to make sure we go over those today, as well as any that we receive here online as throughout this hour. So, Erica, do you want to begin?
Yes, ma'am. does exist.
Yes, that's what I was alluding to when I said the early lessons learned to avoid any wastage. We have put in place an SOP in conjunction with the line leadership that creates a standby list for the next in order. So the next group that would be most likely receiving the vaccine is our first go-to list, and that's coordinated such that the line leadership can activate that, and we have contact numbers and names so that folks can quickly arrive on scene. Sometimes we only have 30 to 60 minutes before that vaccine would otherwise be wasted, and so that is our current plan. And while it is allowed to go off schema for those few handful of doses, we have very much established an SOP across the whole AOR that is still in keeping with the schema.
Next question. This is in reference to testing. When will results from testing be available in a more timely manner? Some of us have had to wait 3 to 5 days for test results, and that's not acceptable considering pre-travel testing or post-quarantine testing.
Nobody should be waiting for their test result for 3 to 5 days. We recommend looking up your test results on TRICARE online portal regularly. You are able to contact the COVID administration team at 243-9775 or 9776, and if for some reason you have not received your results within 72 hours. Travel testing depends on the requirement by destination, which is variable, but most of the time we are using our antigen testing, which comes back within 15 minutes. So we encourage you to wait and then receive the results of your test and the clearance letter that you will need for that flight. The good news is that to date, a lot of our testing has had to be sent out to an outside lab. And while those turnovers are 24 to 48 hours, that still can put it very close to that 3-day window that we are striving for. As of next week, we will have expanded high testing capability at Yokosuka, and we'll be able to process through an additional 11,000 tests per week. So this is very exciting and should hopefully improve much of that wait time. I think it's also important to know for testing out procedures for ROM that there are varying requirements. So we encourage folks that are in ROM to come to testing at day 10. This allows for the 2 to 3 day turnaround time of the lab so that you can exit your ROM period at the 14-day mark with that negative test known and shared, which would release you. However, for those attached to 7th Fleet, they do have more rigorous requirements, and their testing is required to be at day 14. So we appreciate that creates a further time period for you in ROM, and continue to work diligently to get those results. So please alert us if those tests are taking more than 3 to 5 days.
Can we get some clarification as to possibly when our high-risk patient population can get vaccinated? Understanding that our active duty service members are, of course, being vaccinated first.
Yes, so I think when we talk about high risk, it's important to separate out, according to the DoD schema, first the issue of age, which is a risk factor. So all of those over 75 fall under the 1B category. And I'm happy to tell you nearly all, 99%, have been in receipt of the vaccine. We are now working through their second doses. As far as other high-risk populations, those greater than 65 and high risk by medical chronic condition, those are on the next phase of the schema. And so we have those lists actively pulled, and we are tracking those for when we do get to that area of the schema. I know there's also sometimes a question of the high-risk criteria and how is that determined. And that is determined by the CDC and has been put out across Navy medicine and, in fact, across all the DoD. So that is a data pool that is centralized that we are utilizing.
Okay, ma'am. Can we get an actual time frame as to when teachers, CDC, SAC, and CDH providers will receive vaccines? I know that this has been said multiple times on multiple pages, but teachers in the above categories are providing services for nearly all base children. Many of us seeing 100 plus students a day in 80-minute classes with 15 to 24 kids per period.
Yes, so I'm glad to share with you, the frontline workers are 1BC on the DoD schema, and we are very confident that we will be able to get to this group this month, as well as our Shore Command active duty.
All right. Our next question. My apologies. How will the public vaccinations beyond the active duty personnel and frontline workers will be executed? Will it be as when the flu vaccine was given at the gym? So essentially they're asking for locations. How are we going to do this? Will it be the same as the flu vaccine?
Yes, it will. So you are talking about phase 2 or tier 2 on the population schema. And if you're not familiar with the schema, we do post that on our Facebook page, and we continue to post what category we are working with. And so you can always see who's next. But you're referring to tier 2 populations, and they will get vaccinated very similarly to the flu vaccine. The event will occur in a large public building or buildings that provide ample space and enough capacity for hundreds of people at a time, and hundreds of completed shots per day. So we are ready to do over 1,000 shots a day. We're actually capable to do them in multiple locations. Our limiting factor is the shipments right now.
Okay, ma'am. For families PCSing from Yokosuka in the next few months, can they receive a vaccine before they move?
Unfortunately, a PCS from Japan to CONUS is not a criteria at this point that changes an individual's priority within the DoD population schema. I think one of the challenges we also need to consider is that the vaccine, now that there's 3, are being distributed to different sites based on their austerity and inability to maintain it. So we've already been challenged with the issue of somebody who's received a Pfizer vaccine in the United States, dose 1, and now needs dose 2 here. And we very much want to follow it along with the CDC guidelines, which strongly recommends we do not mix the vaccines. So for those reasons, we share that concern, but at this point, it does not change your criteria on the schema. I know that's disappointing to many.
Thank you, ma'am. Does the priority on the list only apply to folks working on the base? Healthcare providers that are SOFA-sponsored but working out in town at a clinic or hospital as in a registered RN, are they still considered healthcare providers in reference to the vaccine?
That Marcy, they may need you to repeat the question.
Okay. So I think the question is, if you work off base in such a capacity that you are considered high risk or higher up on the schema, will that be honored here? I've not had that question posed up to my level. I'm not sure of that actual answer, so I'll have to post that back on Facebook. It's a great question. I obviously think that there will just need to be some validation related to that, but obviously we very much are partnered with our host nation and anxiously awaiting their vaccination. So those working out in the community are obviously of concern to us as well. So let me bring that back to you, and we'll post that later time. Thank you.
Yes, ma'am. Can the hospital post the eligible date ranges for those receiving their second doses at the ShotX site so people don't wait an hour in line only to be turned away?
Yes, last week was implemented the Fast Pass. So I know the team that is monitoring the line to make sure it is COVID safe are also now questioning each person in line to verify if they're there for first or second dose, and if their second dose potentially late on that, they are getting Fast Pass to the front of the line. That was newly implemented, so we share that concern, and I believe the strategies in place now will address that.
Thank you, ma'am. Why has USFJ and most of the Navy in Europe already vaccinated dependents? I know you've touched on this before, but the addendum to that is, how is the vaccine being allocated to the bases on CONUS?
Yes, the distribution at the service level is something I can't speak to because that we have notifications that come out on the Navy side on a weekly basis that state which locations are receiving which type of vaccine and by certain amounts. We don't actually have information that extends weeks out or that provides to us information across all the services at this time. So I'm not able to fully answer that question, but I do think what I touched upon earlier really needs to be emphasized. We have the largest fleet concentration here, over 40,000. And that's quite impressive. And if the other services combined have under 3,000, we can, doesn't take too much math to realize that they have moved on in the schema. And so we are, as I said, working through the fleet. And the great news is not only are the acceptance rates high in the fleet, but we believe that we will complete the vaccination of the fleet over the course of this month.
Thank you, ma'am. We've received a very recent question. Given President Biden's statement today, will teachers be moved up in priority for their vaccine? And there have been several questions requesting information on the teachers' priority for the vaccine here at CFA.
So currently the teachers are considered frontline workers under 1BC, and they very much are. That is the part of the schema we are working through right now. As I said, we will finish with the fleet here very shortly, and I expect frontline workers as well as the rest of our forward deployed active duty to be offered the vaccine over the course of this month. Whether we finish everyone this month will depend on the shipment supplies and numbers, but we will certainly be beginning those groups this month. And we're really excited about it.
Thank you, ma'am. The questions are coming in really fast, so bear with me, please. This is in reference to about support person's role at our hospital, and if the support person has been vaccinated, would that be given consideration during incidences such as childbirth and visitors, if they can show that they've been vaccinated?
The good news is that we've recently updated our visitor policy, and it allows for a caregiver, whether that be a spouse or another designated person, to join a birthing mom during the delivery and to remain as that visitor coming and going through their entire admission. So we have recently made allowances for that. We have had some special cases, prolonged inpatient stays, where both parents can contribute to the benefit of the child's care by having them be a part of the visitor program. So we have, on a case-by-case basis, had an exception to policy, and I would request that if you feel you have one of these particular situations, that you route that to us. We are continuing to revisit the visitor policy, and I expect that we will have an update within the month. We do post all of those on Facebook, and thanks for the great idea to make sure we are considering those that are immunized. We will factor that into our next update.
Ma'am, this is a two-part question. How do we find out if we qualify as a high-risk patient, and at which tier?
Yes, we will go ahead and place the CDC's website to you on our Facebook site. For those that have a pen and paper, it's www.cdc.gov/coronavirus/need-NCOVA/people-with-medical-conditions. And at that site, it will tell you whether you meet that criteria.
And a follow-up. One moment, please.
Continue 7 days a week at this time.
Okay, ma'am, I have a question about COVID testing. Can you post the standards of what to expect when getting tested for COVID? What type of test is administered in which scenario, i.e. standard versus the rapid testing?
Yes. So if we're talking about someone who comes in with symptoms, if you're considered to have a need for a diagnostic test, you're going to have the antigen testing done at that time, which is the on-site testing with the results available within 15 minutes. Some individuals, depending upon their risk category, and I leave this to the clinicians on scene to make these calls, still will proceed with the PCR testing, which is the gold standard. This testing turnaround time can be measured in a day and sometimes up to 3 days, depending upon if we send that result out in town. And for many folks that are considered at higher risk, we want to use both tests. We love having the immediate test to provide you information and guidance up front. In those high-risk categories, we always give you those precautions to remain SIQ until that PCR test is made available.
All right, ma'am. We have a comment/question. We now have to get a negative test result 72 hours prior to flying. We also have to have a negative test upon arriving at the airport. Why do we still have to complete 14 days of ROM? Can we do away with the ROM requirement, especially as the vaccine is being rolled out? It just seems like overkill to me.
I will pitch in here, Carolyn,
Okay.
just to help out a little bit.
Thanks.
Although I know you have the answer to this one as well. I can't tell you how many times we have seen in the past year an individual who tested negative prior to departure for travel, negative upon arrival at the airport, and then tested positive at the end of their ROM period. So as we learned early on, this illness incubates over what can be a very long period of time. And so something that's picked up at the airport during travel may be still working through the system, you test negative, but some days later after you arrive at your destination, you become ill or you become a positive case. And that is what is going to continue to drive the ROM requirements, at least for the foreseeable future. The good news is that our ROM program is rock solid. We have no instances that we can speak of over a year and many thousands of people who've traveled and been in ROM where we can say that someone transmitted this case from outside of Japan to our population in Japan because we didn't have them in the right spot. So it's been good news in terms of the outcome and success.
Thank you.
Thank you, sir. We have a question about relaying of information. Is it possible to have information cross-referenced on the CFA page as well as the hospital Facebook page? And is there any, my apologies, and utilizing other avenues for disseminating information regarding not only the vaccine but also COVID changes as well?
I think from the perspective of CFA, I know that I've encouraged my public affairs officer, and I'm looking at him across the room here this afternoon, that we try to cross-pollinate information as much as possible. So when the schema gets posted on the hospital website, we've typically reposted that on ours as well. I've also been working with my team awful hard in the past year to make sure that questions that people have that are Googleable show up in the Google results. So if you want to know about the ROM policy for Yokosuka, the idea is you just type in ROM Yokosuka or travel policy and you go to our public-facing webpage and it's there. And we've tested this out. We've really tweaked how we present information and trying to make things as easy to find as possible. We will continue to work very hard on that.
All right, thank you, sir. And it looks like we've gotten through most of the questions, and I'm just going back over it. Unless, ma'am, you have other questions that are coming your way, but I believe that we've addressed almost all of the questions in our this afternoon. So we've had hundreds of people log on today and watch us, so that's important. And we're also saving this video, though unfortunately we've had some video issues. The audio is still going, and we will save and share this on our Facebook page, as well as every question that has come through to us via the Facebook solicitation for questions, as well as the Facebook Live, will be answered and responded to and posted as a document on our Facebook page. So to be used as a reference for our entire community at large. And by all means, please feel free to continue asking questions, either direct messaging or posting on our Facebook page, and we have someone on our staff that will answer within 24 hours. So we appreciate everyone's attendance and asking of very important questions for COVID and our COVID vaccination rollout. And I believe that's all for the questions, ma'am, that I have so far.
Great. Just would like to touch some final points over again to all before we sign off today. Thank you all for your patience during the pandemic. The vaccine rollout puts us on the offensive. We are far exceeding the percent of Americans that have been vaccinated across this base, with 33% of the population now vaccinated, and acceptance rates in the high 90 percentile across the board. This is truly exciting and historic. 99.99% of all the vaccine has gone to the appropriate person on the schema. We continue to revise and learn our lessons. We've lost nearly none of the vaccine, but we are learning every day, and we are learning from the feedback you are providing us and making our processes better. So thank you for your questions. Thank you for your patience. We will be moving forward on the schema this month into additional Phase 1B personnel to the active duty tenant commands, our frontline workers, and we're really excited about that. We are challenged by the target that Lieutenant General Place put forward for us to vaccinate the whole beneficiary population. I say not 80% by July 4th, but 100%. That's our target. That's what we're moving forward with. As I have more information and details, we will provide that to you. Captain Jarret, anything for final remarks?
Well, I think, aside from the vaccines, we can be encouraged with how things are going within the country of Japan as well. I've been impressed with the Japanese people's response to COVID-19 since this all first started last year. We got awful worried this winter with the cold and flu season, and we saw the seasonal spike, but I'll tell you what, they have really pulled things together, and we've seen dramatic declines in cases off base. And that's going to result in some lifting of health protection measures, some starting this weekend with folks being allowed to use mass transit and off-base hotels. We're going to open up the Liberty and Travel area again. What will not change just yet is that we're going to continue to have an evening curfew, which I know is probably not the most popular thing, but it is aligned with an extension of the local area state of emergency for another 2 weeks until the 21st of March. And we've just seen the nightlife and evening social activities have really driven a lot of cases, not just in our population, but off base as well. And Japan has really come a long way in the past month, and I think it's really encouraging that they're going to stick with the program another 2 weeks to try to really nip this in the bud and get us on to better days. So we owe it to our host nation to support them, and I'm encouraged that everyone will hang in there for a couple more weeks, and then once the cherry blossoms are blooming, we'll be able to get out and about and do some great sightseeing adventures in Japan, perhaps even Tokyo again, because the numbers there are looking very good as well.
Wonderful. Thanks so much for coming today. We very much appreciate it, sir.
Thank you.
All right. Thank you, everyone. We're signing out here.